Welcome to Friday's edition of COVID-19. I'm Min San-hee. As healthcare workers seek to tackle rising cases of domestic and imported infections, officials are also seeking to ensure a sense of normality. And as part of such efforts, following the opening of museums, public facilities that is, like museums and art galleries, spectators to baseball and football stadiums can look forward to visiting those places themselves as well, albeit in smaller numbers, of course. We start the program now with the latest figures on the pandemic with our Soa and related news with our Hong Yu. So how are we ending the work week on this Friday?
Well, Sunny, similar to yesterday, this Friday's local infections are double the amount of imported cases, at least according to the latest figures, the official figures as of 12 a.m.
Right. So I also hear that this weekend we're expecting a rise in cases from abroad owing to a number of factors.
Exactly. Well, almost 300 South Korean nationals have returned to Korea from Iraq this Friday, and all of them will have to undergo COVID-19 tests, which means if some of them test positive, we are expecting higher numbers in imported cases. And also we have some 30 new cases related to a Russian ship, and that was confirmed this Friday, but those numbers are also expected to be added to Saturday's tally. But if we take a closer look at today's official figures, we have 41 new cases, and that includes 28 local and 13 imported cases, raising the total to almost 14,000. The death toll stands at 298. 864 people remain in quarantine, and 12,817 people have recovered, with 59 new recoveries. Now, if we go over to our graph here, compared to last Friday when we had 60 cases, today's number does look much better. But if we take a look at earlier this week on Monday, when the figure dropped to below the 30s for the first time in 3 weeks, we do see some increases here, and that is largely attributed to new cluster infections in the country. With that, let's take a look at our map now. We have 21 new cases in the capital, Seoul, and 8 in Gyeonggi-do province, so almost 30 concentrated in the metropolitan region, but also sporadically new infections here in the southern parts of the country. Now let's take a look at the global figures. We have a total amount of more than 15.6 million cases, with over 277,000 new infections in the past 24 hours, and some 636,000 fatalities and 9.5 million total recoveries. Now, meanwhile, the top 3 countries when it comes to numbers of total cases now account to some 7.7 million. We're talking about the U.S. with approaching 4.2 million, Brazil almost 2.3 million, and India nearing 1.3 million. And these countries are adding some tens of thousands new cases. In fact, high 40,000s in India, high 50,000s in Brazil, and high 60,000s in the U.S. That remains a concern. And here in South Africa, it has surpassed the 400,000 mark, with some 13,000 new infections. And over in many countries in Latin America, apart from Brazil, numbers are also surging here. Mexico and Chile with 370,000 and almost 340,000 cases respectively. And those are the updates I have for now, but I'll be back after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. North Korea continues to claim that it has no COVID-19 cases, but there are updates on efforts there to manage people who show symptoms of the virus. I have our North Korean affairs correspondent Hong Yu here in the studio with details. Welcome, Yu.
Thank you for inviting me.
Right, now the World Health Organization has some updates on COVID-19 in North Korea. Please tell us more.
Yes, that's right. The World Health Organization released the number of people who have been tested for COVID-19 in North Korea, which stands at 1,117 in total as of July 6th. All of them have tested negative, according to Edwin Salvador, the representative of WHO office in Pyongyang. Salvador said Monday that 610 people are in quarantine, and these are people that work near the border city of Siniju and workers that transport goods from the Chinese border city of Tandung. The growing number of people in quarantine from 225 people last month to 610 is due to the increase of goods shipments coming in from China. The WHO representative of the Pyongyang office added that 1,000 COVID-19 test kits sent from the organization's Southeast Asia office is set to arrive in Pyongyang next week.
Now, despite claims of being COVID-19 free, North Korea has nonetheless joined the race to find a vaccine, I hear.
Yes, that's right. Pyongyang's Science Research Council said that its scientists are conducting a clinical trial to develop a COVID-19 vaccine. The North Korea claims the candidate vaccine triggered an immune response in animal testing and that clinical trials have started from this month. But this claim is quite doubtful as North Korea has one of the most dilapidated healthcare systems in the world. They have long depended on the World Health Organization's supply of vaccines and immunizations for its people. With unreliable sources of electricity and water, their medical facilities are often short of medicine and other equipment. So there is a possibility that the North's claims regarding a COVID-19 vaccine could be just a part of the regime's propaganda efforts.
Meanwhile, your new hospital in Pyongyang is gaining much attention lately with Kim Jong-un himself visiting the construction site, I hear.
Yes, the regime is putting a lot of efforts into showing off their new Pyongyang General Hospital. But when the North Korean leader Kim Jong-un visited its construction site, he was reportedly unhappy with the progress and fired the supervisor in charge of budget management. Experts say North Korea may be struggling with the construction of the hospital due to various challenges. Let's take a listen.
Kim's scolding shows that North Korea is having difficulty in supplying construction materials for the Pyongyang General Hospital amid the COVID-19 pandemic and international sanctions. But as the hospital is Kim's greatest interest at the moment, he will continue to push for its completion.
The construction of Pyongyang General Hospital began in March and was scheduled for completion by October 10th, the 75th anniversary of Workers' Party of Korea. Since then, it has featured prominently on North Korea's state media.
Now, North Korea shut down its borders earlier on in the pandemic, but I understand there are signs of it choosing to reopen its borders.
First off, Japan's Nikkei Shimbun reported Wednesday that trade between North Korea and China from the month of January to May this year had dropped by 69% on year. That is due to the border shutdown by North Korea in late January. According to China's General Administration of Customs, North Korean imports from China were tallied at $295 million during January to May, a 68% on-year fall. But it looks like North Korea will soon resume tourism, one of their main sources of hard currency. A travel agency in the Chinese coastal province of Liaoning said that a travel agency in North Korea had told them the North is likely to accept Chinese travelers coming into North Korea starting from November. Yet there are also others that said visits to North Korea will not be possible within this year as there are new COVID-19 cases still being reported in China.
I see, so we'll just have to wait and see. All right, thank you very much for that coverage. Hope to see you again soon.
My pleasure.
Right, it's time now for the regular government briefing on COVID-19 here in Korea. And while we wait for that to commence, here are some related news. As of 6 p.m. today, the ban on small gatherings for religious purposes, including Bible study and choir practice, will be lifted. Officials nonetheless are reiterating calls for caution and to refrain from such activities if possible, as they raise the risk of infection when they take place in confined and congested places that are also poorly ventilated. Preventative measures including the wearing of face masks and social distancing practices during regular church sessions are also being strongly advised. Also, earlier on this Friday, 2 military aircrafts carrying almost 300 Korean nationals from Iraq have arrived. Most of them are people working in the construction sector stationed in the Middle Eastern country, where at least 3 have died from COVID-19. These individuals are poised to enter 2 weeks of quarantine before being allowed into the local community. Over in the sports arena, some promising news for fans today. Come this weekend, baseball stadiums are looking to welcome back spectators, albeit in smaller numbers. The briefing has started. We'll come back to you afterwards.
Let us now begin our regular briefing for July 24th, Friday, on the COVID-19 situation here in South Korea. We have new infections and new local infections amounted to 28 today and 13 new imported cases. And the total number of confirmed cases now stands at 13,979. 59 more people have been discharged and a total of 864 people are in quarantine undergoing treatment. Unfortunately, we had one additional fatality and the death toll now stands at 298, and we also have the death tolls of from the heavy rainfall, and I extend my deepest condolences as well as to the deceased and the members of the bereaved families. And here are some updates on major domestic infections. At the Kangsoku Central Daycare Center in Kangsoku District, Seoul City, we have one additional case, and a total of 21 cases have been confirmed to date. And in relation to this daycare center, 2 of the confirmed cases in early July has visited a building, Seongmin Building in Bucheon City in Gyeonggi-do Province, and thus we are conducting epidemiological investigations, and we have sent out SMS message to all of our public to also notify the people who have visited this building from the 21st to 23rd of July to get tested if you have you visited this place, even if you don't have any symptoms. And in relation to an office building in Gangnam-gu District, Seoul City, we have additional cases, and the total now stands at 26. And related to the Love Church in Songpa-gu District, Seoul City, we have done the testings for 136 churchgoers there, and we have additionally 10 more people being confirmed, and the total now stands at 18. And in relation to a military unit in Gyeonggi-do Bucheon City, we have confirmed that 4 military soldiers who have visited a church has been tested positive, and a total of 21 people have been confirmed to date. And as for risk factors during the religious service, they did not wear face masks properly, and they did not also abide by quarantine measures such as banning the singing, group singing. And in relation to a family in Gwangju City, we have additional cases, and the total now stands at 9. And next, here are some updates on our imported cases. We have a total of 13 new imported cases today. 3 of them were confirmed at the points of entry, while the rest of 10 people have been confirmed while they were on self-quarantine. And among them, 6 people were South Koreans. And out of the 13 people that have been confirmed, 4 from Americas, 3 from the USA, 1 from Oceania, New Zealand, and also 18 were from Asia, excluding China, 3 from Uzbekistan, and 2 from the Philippines. And in New Zealand, the patient from New Zealand, because New Zealand is also notified as a COVID-19 free country, we are currently conducting epidemiological investigation behind this person. And the KCDC, starting from July 8th, we have confirmed that a Russian flagged ship, a fishing vessel, that has been docked at the port of Busan. We have confirmed that on the 8th of July, we conducted an onboard quarantine. We did not see any specific developments then. However, we have identified that the vessel maintenance worker has been confirmed positive on the 23rd of July, and that is why we conducted the testing of all of the 94 sailors on board, and out of them, 32 sailors tested positive, and the rest of the 62, as of now, they have tested negative. And in relation to this vessel maintenance worker, we are conducting the testings of all of this person's contacts, and we have confirmed, also tested the people who are family members, friends, and colleagues. We conducted 150 tests, and in total we have found that 15 people have tested positive. So we say that as for the 32 sailors and the 15 other people that have tested positive were not included in today's statistics. And moreover, here are some updates on the global COVID-19 trends as well. With the serious COVID-19 situations in Iraq, we have been returned, that 297 South Korean workers have returned, and more exactly, there were 2 flights, and at about 10 a.m. today, both of the flights arrived safely at the international airport. All of them have been screened of their health conditions before onboarding the plane, and also they were tested at the gates, a special designated gate in the international airport. And those who have tested positive will have been moved directly to the public health center as well as live treatment centers, depending on their seriousness of the symptoms. And even though they tested negative, they will be on self-quarantine at a special temporary shelter place. So their quarantine date will be until the 7th of August. And we also would like to note that as they are on self-quarantine, we will have a pan-government TF team to also look at their health conditions as well as carry out quarantine measures. Up until now, we have seen no case of a local transmission of the virus stemming from this temporary shelter place, so we will be exerting our full efforts this time as well. As for the Korean workers who have returned from Iraq, as well as all of the Russian flagship sailors, out of the people coming from Iraq, we have confirmed that a total of 89 people have showed symptoms, and we have 32 sailors being confirmed on an Russian flagship, and also there were 5 people who are in relation to the vessel maintenance workers. So we believe that through tomorrow's briefing and tomorrow's updates on the statistics, we will have a major increase in the number of confirmed cases tomorrow. And if we look at the total number, this number will increase above 100, meaning that it will go into its 3 digits. Even though this takes place, even despite the fact that we show this increase, we will be confident and we will also reaffirm our dedication and determination to protect our South Koreans from Iraq. So we will also exert our full efforts for containing the virus as well. So we would like to give a special message to the public that please do not be too surprised by the sudden increase of the number of COVID-19 confirmed patient tomorrow. Here are some updates on our R&D procedures as well. The KCDC also is currently carrying out our clinical data-based analysis, and we have also disclosed the information of the 5,500 people, and we have selected the research projects on 9 health institutions. And yesterday, we had secondary procedures, and we have additionally confirmed 8 tasks, and they include using AI to predict the severity of the conditions, and there are many other tasks as well. And lately, we have seen a lot of damages through the heavy rainfall, and we also had some fatalities as well. The KCDC would like to note that if there were people being refuged after the heavy rainfall, we will provide. Also, when you are at these temporary shelter places, you need to always wear face masks and also keep 2 meters of distance and sit in a zigzag format when you have to eat together. And we will make sure that our quarantine officials will continue to monitor the situation going forward. As for the infectious disease, yesterday we have seen an alert being issued about the infectious disease virus, which is the Japan mosquito virus, and we will also make sure that this does not spread. And if you are also highly exposed to this virus, as for this virus, it also carries very light symptoms as for the Japanese encephalitis virus. And if you also show symptoms, the fatality rate also could amount to 30% if this is severe. And we will also make sure that all of our children above the age of 12 months and under the age of 12 need to get vaccinated. And even after the heavy rainfall, because of the puddles, could be the habitats of these mosquitoes, and we also ask you to take particular precaution as well. And as for the regions that have seen great damages, we also through the rainfall, we believe that you could also be prone to skin infections as well. So we continue to ask you to take particular caution. And during the weekend, we also would like to note that you need to also remember to carry out the quarantine measures. And if you are going to the religious services and you need to decrease the number of participants, you need to always wear face mask and keep 2 meters of distance. Use instrumental versions of songs rather than singing, and please do not share food or have group meals. In relation to our regular briefing, we have some updates. The COVID-19 pandemic, nobody can expect the future, and this is same with all rest of the countries. And we believe that any pandemic that has been outbreak after the 20th century, we also do not have such a very similar trend, and we are seeing a very unprecedented trend. It was very different from the Spanish flu and the previous infectious diseases. The situation is very different, and the vaccination as well as the therapeutics as well. These are the news and stories about the future. So we believe that distancing and wearing face masks is the best effective cure against the virus. So we ask you to abide by the following 3 do's. So please confirm if you are going on a vacation. Please confirm that you are not going to indoor places, and you need to avoid going to indoor places with poor ventilation. And if you need to go to these places, please minimize your time of stay there, and please check whether you are going to crowded places as well. And if you are planning a large group meeting, please switch to non-face-to-face contact. And also, if you go to restaurants or cafes, or if you work for a long time, or if you work out for a long time, you can also be exposed to the virus when you are indoors. So we always ask you to wear your face mask. And we have found that many of the people have been wearing their face masks outdoors when they take them off when they go indoors. So we would like to make clear that this shall be the opposite manner. And as for the religious services, starting from 6 p.m. today, we will be also lifting the executive action that bans the religious small group meetings. However, we ask you to continue to comply with our quarantine measures. And even if we go on eased life distancing measures, we can never go back to pre-COVID-19 days. If our society goes back to our pre-COVID-19 days, we believe that this is highly unlikely. However, please remember that we have experienced a massive outbreak in Daegu during the months of February and March. And also lately we have experienced a large-scale infection among the metropolitan area, especially from the Itaewon clubs. And we also would like to note that many of other countries are going through very severe stages of the pandemic. And if you can comply with the quarantine measures today, we believe that tomorrow's health and tomorrow's safety will be different. And if you stay complacent, this will also speed up the disaster from the future. So thank you very much.
Right, that was Kwon Junuk, the Vice Head of KCDC, with Friday's afternoon briefing. Swa, do give us a gist of the main announcements.
All right, well, if we take a look at the official figures today, it looks like we have much more local infections than imported cases because we have in the metropolitan region, we have new clusters at churches, daycare centers and office building, and also 4 new cases related to the Pocheon military unit in Gyeonggi-do province, raising that total to 21. But tomorrow things may look very different because we have imported cases that were not added to today's tally, including the one related to a Russian ship where 32 people tested positive. But according to Kwon Junok, there are 4 additional people who tested positive, which are ship maintenance workers. So these numbers could be added tomorrow. And we have also more than 290 people who returned from Iraq, and those are all being tested for COVID-19, while those with who test positive will go to treatment centers, and who test negative will have to go into a 2-week self-isolation period. So we may even see a 3-digit number tomorrow in new cases. That's why Kwon mentioned and asked the nation's people to not be too concerned or too surprised at tomorrow's tally. That's all I have for now.
All right, so thank you for that. We'll see you again on Monday then.
See you next week.
Right, non-face-to-face interactions are becoming the norm amid the pandemic. And in recent days, even a trip to a convenience store can take place without an interaction with the store attendant. I have our Chun Song-cho with details on that. Hello, Song-cho.
Good afternoon, Sunny.
Song-cho, please start by telling us where you are.
Yes, so I'm at one of the branches of E-Mart 24 in Gimpo City, Gyeonggi-do province, and this is just not like any other convenience stores. It's equipped with state-of-the-art technology that eliminates the need for human cashiers. That's right. So you don't have to come into contact with anybody or touch anything from the moment you step in to the moment you step out of the store, even when you're paying for the products that you want to purchase. Well, as convenient as it sounds, touch-free, cashless, contactless payment system, whatever you want to call this system, if you've never been to one of these stores, then you might wonder, so who keeps track of who buys what? So today I'm going to show you how exactly the system works, so follow me, don't go anywhere. So first of all, you have to make sure that you have the SSG Pay mobile application downloaded on your phone. And this is where you register your credit card that you want to use for payment later. And then this will give you a QR code that basically works like your identification card. So I already have mine installed and registered like this. So let's get inside without further ado. This is where you scan the QR code like this. All right, so welcome to the store. As you can see all of these snacks, food, beverages that you can get your hands on. But what's different about this store is, look at the ceiling up there. There are all dozens of cameras and sensors that trace people's movements. And then it also can detect what shoppers take from the shelves and put back. So, and then it'll automatically add selected items onto the virtual cart on your mobile application. So let's give it a try. I have to confess, I have a sweet tooth, so I'm going to go for this old school snack. This is going to be my guilty pleasure of the day. So for me to purchase this, all I have to do is just walk out. That's right, I'm dead serious. That's all I have to do. I promise you, I'm not trying to steal anything. So, here we go. I just walk out, and it automatically calculates the total checkout value and makes the transaction the moment the customer passes through this checkpoint. Well, this kind of automated store first opened in South Korea just last year before COVID-19 pandemic, but its feature seems to be valued now more than ever before because to be honest, there's pandemic now ongoing, right? And there's heightened social distancing as well. Well, I want to learn more about this store, how it's being operated. So I'm going to talk to one of the officials from the Shinsegae INC, Mr. Cha Seung-uk from the IT division is here with us. All right, welcome to our show. Hi.
Hey, how are you?
I'm fine, thank you. So incorporating this cashier-free, cashierless system into this convenience store is just brilliant. So what are the core technologies that made this concept possible?
Okay, so as you can see around here, there are a number of state-of-the-art technologies implemented in this store. So, for example, there are, on the ceiling, you can see 31 cameras and sensors to track individual activities and detect items, which items they're picking up from the shelf. So that's part of computer vision. And each shelf here is equipped with load cells. So there are little hardware components that can convert physical energies like compression or pressure into electrical signals that the computer can understand and process to detect the presence of items on the surface. So that's part of sensor fusion. And then back in our data center, deep learning will collect and process data gathered on site from these two sources, sensor fusion and computer vision, to decide which customer is walking out with which of the 800 different items we have in the store. And as you finally walk out, our cloud-based point-of-sale system will automatically charge you the amount you would otherwise have to pay by swiping cards or paying with cash in a conventional store setting.
Wow, I must say, it sounds very technological and advanced. Thank you. Wow, I mean, people say there's an opportunity in every crisis, right? This pandemic certainly upended nearly every aspect of our life, but it is also acting as a forcing mechanism to compel innovation. And I can't wait to see what other changes technology will bring in the years ahead. This has been Chun Sung-cho reporting live from eMart 24, and back to you in the studio, Sunny.
Right, Song-cho, unmanned automated retail is definitely looking to be a part of our everyday life now. Thank you for that report. Sporadic cluster infections in the metropolitan area and relentless cases of infections from abroad are keeping our health authorities on high alert. What's more, health experts around the world are forecasting a prolonged battle against COVID-19. So how can we prepare our medical infrastructure for a long fight ahead? To answer that question, I have Professor Lee Jong-gu from Seoul National University, who is also the head of who was the former head, that is, of the Korea Centers for Disease Control and Prevention. Welcome to the program, Professor Lee. And I also have Dr. Yoo Byung-uk from Soonchunhyang University. Good to see you again, Dr. Yoo. Professor Lee, we'll start with you. Korea appears to be moving a continuous cycle of contagion and containment. One spread begins, we bring it under control, another spread starts. What do you think is the reason for this discouraging phenomenon?
As you know, the COVID-19 control method is non-pharmaceutical intervention, such as contact tracing, isolation, and quarantine. That is very difficult method and very crucial and effective. But in complete contact tracing, each case will be circulating the virus in the community. So this makes resurge or make a new outbreak of community. This is the reason. So I advise the administrator, don't give up tracing and quarantine system. That is very important method.
Of course, so it's an inevitable cycle then. Dr. Yoo, starting from 6 p.m. today, small gatherings at churches will be permitted. They were banned for quite a bit, but now Bible study, choir practice, you can take part in them. Museums have also opened, starting from earlier this week, as well as art galleries, and now baseball stadiums are looking to welcome back spectators. What are your thoughts on these eases in preventative measures, despite the rising domestic and imported cases here?
I have two opinions. As a doctor, we're still waiting for the open the public state. But Korean governments, their measure how to restore the Korean economics and to give them the signal to Korean peoples we are now recovering. So as a signal, I believe this National Museum and the baseball place is open around less than 10% with other than crowded. But the people can be misunderstood. Oh, COVID-19 situation is over, so we are going to be free soon. But we have to remember about earlier May, we have after the Golden Weeks, we have the second wave of the crisis from the COVID-19. So Korean government gave a message to us. Now we are start to restore and recovering, but keep on be cautious about the COVID-19. So please don't be misunderstood. We are not finished yet, but the Korean government giving the signal and the message to Korean peoples we are restoring and restart again to overcome.
Right. Professor, compared to other countries, Korea's death rate from COVID-19 stands at the early 2%, just above 2%.
Yes.
What do you think is the reason for Korea's relatively low death rate?
Yes, that's a good question. Actually, the overall, the case fatality rate is lower than other countries. The reason why, first is we have impacted case younger people. So, and then second reason is early detection of the case. This make us case fatality rate other than country, but some countries have some outbreak in the mental hospitals and the long-term facilities. Then those facility infection make the high mortality rate in the elderly people. So this difference make low fatality rate in Korea.
I see.
We rare case in long-term hospital and social the aid the facilities.
I see. So we've had a greater portion of the young people being infected,
yes.
and we've had less senior citizens being exposed to the virus compared to other countries.
Yes. Yes, aid standardization make reduce the rate in 2 or 3 times.
I see.
Yes.
Now, for more insight into the discrepancies among countries amid the pandemic, I have Dr. Jean Bousquet from Montpellier University live on the line to share his thoughts with us. Welcome to the program, Dr. Bousquet.
Pleased to meet you.
Now, Doctor, you
Good
believe...
afternoon.
Yes, it's a pleasure to meet you too. Now, you believe there is a tangible link between low COVID-19 fatalities and national dietary differences, especially with those regarding fermented cabbage. Please do tell us more.
Well, yes. You know, when you look at the map of Europe, you have England, France, Belgium, Italy, and Spain with a rate of over 500 deaths per million. And even though you cannot compare exactly all death rates, but within the EU, we have something which is relatively standard. And then we have Germany, Austria, and Denmark, which have middle death rates. And then you have Poland, some Nordic states except Sweden, and the Balkans, which have very low death rates. So I think there is something there. And I discussed a lot with a Polish lady, with one of my friends, and we found that a major difference between the food in the high death rate countries and the low death rate countries is cabbage and fermented cabbage. And by the way, when you go to Asia, you have plenty of foods which are fermented, and kimchi is a fermented cabbage. So I think this is something very interesting. So we did an ecological study, and what we found, it is that fermented vegetables, but not fermented milk, is associated to low death rate in Europe. And secondly, we studied vegetables, and the 2 vegetables which are important are cabbage and cucumber. So taking this into account, we could think that there was something in the cabbage and in the fermented cabbage and probably in kimchi. And I do think that the very low death rate in Korea, well, it's done because we have a fantastic health system.
I see, Doctor.
But also,
Dr. Busquet, I think one of our panelists, Dr. Yu, also has a question he'd like to ask you, if you may. Please go ahead, Dr. Yu.
Nice to meet you, Professor Busquet. I read your article, very, very interesting. But I have one question. How does fermented cabbage help our body fight the COVID-19? You commented about the ACE, so, angiotensin converting enzyme 2. Would you explain a little more detail for us?
Well, yes. Well, I have a new paper which will be submitted tomorrow. And what we found, number one, what are the risk factors for COVID-19? They are diabetes, obesity, hypertension, and aging. And this is associated with insulin intolerance and probably with oxidative stress. When you go to the severity of COVID-19, which is lung injury, endothelial damage, and also the cytokine storm, this may be associated to oxidative stress. So if you take oxidative stress, what you can do is, number one, when the angiotensin converting enzyme 2 is attacked by the virus, it is down-regulated. And if you down-regulate ACE2, you go to one pathway, which is inducing insulin intolerance.
I see.
On the other hand, the other pathway is now down-regulated, and this is associated to a transcription factor. So this is COVID. Now, let's go to fermented cabbage. Cabbage contains a specific product. Let's make it sulforaphane to make it simple. But this product is a very potent antioxidant. And then you have fermentation. And in fermentation, you have lactic acid bacilli, which are also antioxidant. And there is a very interesting study in Korea in 2012 by Anne. This study shows that if you take fresh kimchi by comparison to fermented kimchi for some days, fresh kimchi is less anti-diabetic than long-term kimchi. So I think that there are two compounds which are against the oxidative stress.
I see. Well, Dr. Busquet, unfortunately, we have not a lot of time for more questions, but thank you very much for joining us live at this hour with your thoughts. It's been very informative.
Thank you. Bye.
Professor, as part of efforts to tackle rising imported cases, Korea has required travelers from 6 high-risk nations to hand in certificates that show that they tested negative for the virus at least 48 hours prior to departure. But despite this reality, there have been cases of travelers testing positive once they arrive in Korea. What efforts can the government make to strengthen these measures against imported cases?
Yes, Korean government the request immune passport. We call it immune passport, such as medical certification of pre-infection before the 48 hours boarding for the travelers of the high-risk country. But this method is some limitation. For example, the incubation period and the quality of PCR tests, so that alternatives may be needed, such as the designation of the high-risk countries. This country may be restriction of the return to their countries, and some reducing the number of flights and reduce the density of the passengers in the flight, and the assessment of eligibility of the visa. That kind of the method will be helpful to the protection of our countries.
Right. Dr. Yu, I spoke about this earlier on, but the pandemic is expected to be a prolonged affair. What can Korea's medical infrastructure sector do to ensure that it is ready for this long fight ahead?
Well, fortunately, Korean government prepared because we haven't experienced MERS, and it was another kind of disasters. So that's why our systemically to prepare But what you mentioned, so the doctors and the nurses and the medical health providers and the people, so we are a little bit exhausted. But we believe that we can overcome. But before we have another second wave, we should be prepared for the beds, for the intensive care, and triage center for the mild symptoms patient to reduce the mortalities. So now, August, September, before Chuseok holiday, we have to be the adjustment system can be receive the patient soon, and then we were emphasizing to the point of the social distancing again.
Right. Professor Yi, you are, like I said, the head of the National Policy Committee on Public Health. A few words, very short words, on how the government can ensure a better response to COVID-19.
We are promoting the new normal society, such as the long distance education and working and the masking and physical distance in society. That is very important. But this method needs to the community engagement, community participation.
Of course, you need members of the public to take part in such efforts. Yes. Right, all right, Professor, thank you very much for your thoughts. And Dr. Yu, as always, thank you for being with us today. Right, well, that brings us to the end of this week's edition of COVID-19. Be sure to join us next week. And this coming weekend, remember to wear your mask, as our Dr. Lee and Professor Yu and Dr. Lee mentioned as well. In the meantime, do send your thoughts and inquiries to us through our social media accounts or homepage arirang.com. Have a safe weekend.